The most important point is that I honorary member of the Society of Nephrology of Romania, and I was the president of European Association Hereditier on Nephrology, and I'm coming from Italy, and of course I was president of the Italian Society of Nephrology. So I'm normally very good relationship with the nephrologists in Romania, and so I have many opportunity for meeting my colleagues and my friends here.
Please tell us a few words about how you have perceived this Congress so far.
We are at the beginning of the Congress, but the level of the first part of the presentation that I saw was very good, but this was not unexpected because, as I told you, I have had already many opportunities to have a meeting with local nephrologists, and the level for sure is high. The discussion is very relevant, with the possibility of receiving important information about the different point of view. So I think that I'm not surprised that the quality, the scientific level of the Congress is high.
Where is the Romanian nephrology system situated compared to other European countries?
But from the scientific point of view, the situation is the same. The level is very high. In the past, was some difficulties in treating the patient that lost the renal function with dialysis. But during the last year was important progress, and now the number of the patients treated with dialysis increased dramatically during the last year. So we are on the level of the other countries, the developed country in Europe that started many years ago. Also because we have considered the population and the number of the patients treated, we are more or less at the same level as in Italy.
What are the problems in nephrology should be addressed in the next congresses?
But I think that now, but already in this Congress was in some way try to solve this problem, because we are very famous, we and nephrologists, because you are able to perform dialysis and you are able to perform transplantation. But this is exactly the demonstration of our insuccess, because we are unable to avoid the progression of the disease to dialysis and to renal transplantation. So I think we should try to move as much as possible the effort in Europe, and also of course in Romania, in order to try to slow down the progression of the chronic kidney disease, to avoid as much as possible dialysis, also considering that the chronic kidney disease, the renal function deterioration, is at a major cardiovascular risk, reducing the progression of the disease. In the same time, you are preventing the cardiovascular disease.
Can you tell me what is the most important message that should be transmitted after this Congress?
I think that, for example, during my presentation, I underlined that it is important to give the patient drug for controlling the progression of the disease and preventing the cardiovascular disease. But it clearly demonstrated that if you use a low salt intake together with the drug, we are able to obtain better results than using two drugs together. So I think that what is possible to do is to have a look at the food, particularly now that there are many additives, to be careful about the way the food are preserved, because normally they are putting too much salt, too much phosphate, and this for the patient with chronic kidney disease is dangerous. We are spending a lot of money for reducing blood pressure, for reducing for giving statins, for giving drug for controlling hyperphosphatemia, and we are not putting too much attention to the food, the way the food is preserved.
Yes, but also the main stores, the main producers are putting salt in the food, so it's not about us how much
yes,
salt to eat.
But if the government, the responsibility of the nephrology is to increase, to make the government aware of this problem, in order to change the rules for the producer. Of course, you are unable to do it yourself. But if you realize that this is an important way for reducing the complication and saving money, the government is more careful about saving money than taking care of the patient. So if you underline that this is an important way for saving money, maybe they will be in some way more keen to try to solve this kind of problem.